Assistant Director for Health and Social Wellbeing Improvement with the Public Health Agency. So my role is really about promoting health and wellbeing with the population through a number of different mechanisms and working at multiple levels with different organisations and agencies, including the local community organisations. I'm one of 5 assistant directors for health protection, screening, research and development, service development and health improvement here with the agency.
And Mary, what difference has the UK CRC Centre of Excellence made to your work?
Well, I think it's been an extraordinarily important development, because what the CRC has enabled the development is of much stronger relationships between practice and academia and research. So beforehand, research has a tendency to be a wee bit removed from practice. What we have successfully done here is build bridges and help translate expert knowledge and expert research and combine that with the real world and practice and those people operating in that situation. So what it has brought is new opportunities for research, and as I say, aligning that with real life practice and really expanding and extending the amount of research that is undertaken, but its applicability and showing new insights, new areas of work that are very important in terms of understanding the impact of health improvement and health improvement initiatives. So I think it has been exceptionally important in a number of different areas, whether it's physical activity, breastfeeding, mental health and well-being, the work we've done with education, and it's quite a good example to take. So we introduced a pilot programme called Roots of Empathy, which aims to improve social and emotional well-being in children in schools. And through the centre, we were able to apply for funding, conduct a randomised controlled trial. So we're looking not only at the impact of that programme, but we have used that learning to influence then what kinds of programmes should we be putting into schools. And we have further commissioned a meta-analysis of other social and emotional learning programmes, and ultimately we're going to use that together with a scoping of the work currently underway in schools to inform a framework for social and emotional health and well-being in the future in schools in Northern Ireland. And that train of development I don't think would have been possible without working with the centre and the expertise and the access to research and its applicability. Just simply wouldn't have happened like that.
Mary, what has been the single best or most important feature of the centre's legacy?
I think the relationships that have been forged between both different schools within the university, different universities, the partnerships around research have been very important, but also bringing together those multiple interests. And we know that public health is complex. It is not one simple single answer. So we need to understand those different environments, the different way in which change happens in order to have greatest impact. So public health requires us to work with all those different disciplines, different organisations, but to do it effectively, to do it in a way that will have greatest impact. And I think the centre has made a remarkable contribution to our understanding.